Okay, so now we're in the study follow-up. So one woman's been randomized. That's kind of her first visit, but that's still part of screening that I discussed in my messages. That's the screening randomization visit. So then she moves into study follow-up as a study participant. So the goals of this phase are to continue with the study intervention, the pills, to collect safety information, and to make sure she's safe along the way, and then to encourage adherence and assist with any issues she may be having, if she's having symptoms or whatever, you can help her along the way with that, and to collect the follow-up data. And that's, for the most part, the outcomes. Again, the hot flashes, as Brian mentioned, the thing that's very important is we want to keep collecting that hot flash information. So I guess we don't need to look at this again, but so what we're going to talk about now is starting below the escitalopram and placebo boxes. This next part of the talk is going to focus on what happens after that, starting with the 1-week phone call. So, so the overview of the follow-up steps, again, that table 1 that I handed out through this part of your packet. The screening randomization visit we already talked about. When she's randomized, she has a week 1 phone contact, and she comes in for a week 4 visit. There's an at-home urine collection that happens toward the end, right before she comes in for her week 8 visit, and then there's a week 11 no contact. So the very first post-randomization contact is a week 1 phone call. There's going to be a form and a script for this. I don't have it here, that's something that Barbara's working on, but at that point you're going to review her, if she's had any side effects, talk about adherence with her, any issues that she might be having. This is really just to see how it's going, to encourage adherence and to make sure she's not having any problems, to provide tips and support. It will depend on what her issues are. Hopefully there aren't any, but whatever's going on, you need to check in with her and to see how she's doing. It also serves as a reminder for her to complete her hot flash diary each day. So you want to let her know that, just make sure that's going okay, and she doesn't have any questions about that. And then you want to confirm that week for a follow-up visit, which certainly at this point will have already been scheduled. Then there's the week 4 follow-up visit. At this visit, which is kind of what happens about 4 weeks after randomization, the following occurs. You're going to ask her to bring her study pills back. They're going to be counted and recorded. You can't sit and count them right in front of her. It wouldn't necessarily be something that is obvious to her that you're monitoring adherence. In fact, at this point, she gets dispensed a new set of pills, so you would actually just set the bottle aside. You can count it later, but basically you want to get her a bottle of study pills. There is some safety monitoring adherence information that's going to be collected at that point, and Barb will be talking about that after this. And then you're going to do the physical measures again, the blood pressure, pulse, and weight. There's a table that I don't have here, but it's in the protocol. There are certain steps to take depending on what her blood pressure is at this point. If her blood pressure again is that kind of pre-hypertensive, she still stays in the study, but again, you want to refer her to her physician for follow-up, just for safety, not so much with SSRI, but just general safety. Should you discover that she has hypertension or pre-hypertension, you want to know that. A urine pregnancy test is obtained for all the women who are not postmenopausal. So at this visit, you definitely do need to do a pregnancy test to just make sure that she hasn't become pregnant in the last 4 weeks. You're also going to complete the week 4 follow-up questionnaire, which I don't have the first page up here. It's because we're still drafting that. The week 4 questionnaire is mostly very similar to the Form 102. It has a lot of those same baseline items again, her quality of life and those sorts of things. And then you're going to collect her hot flash diaries for the previous 4 weeks. And you're actually going to need, that actually should probably be first, because while you're doing some of these other things, somebody needs to be data entering the hot flash diaries, because the data from those hot flash diaries will determine how many pills are dispensed for the next phase of the study. So this is something that you need to get in to the database actually during the visit. So, so as I mentioned, the study pill dosage is going to be reviewed based on what happens in the hot flash diaries. Some participants are going to remain on 1 pill a day, and some are going to increase increase to 2 pills a day. And again, this is something that the database will let you know. You put in the information and it will tell you, dispense 2 bottles, and it's bottles, 252 and 253 or whatever. It will tell you which bottles to dispense. And then you instruct the woman to take either to continue taking 1 pill a day or to take 2 pills a day. And you schedule the week 8 follow-up visit if it hasn't been scheduled already, which you should have. And you give her, again, the booklet with the pill safety information and instructions in case she lost the first one. And a hot flash diaries to complete between week 4 and week 8. Again, I'd say probably give her 5 weeks worth of diaries. And instructions and supplies to collect the urine sample to bring them to the next study visit. In case she doesn't do that right away, she does it the day before her week 8 visit. But if you give them to her now, she'll have them so that you don't have to mail them out right before her. And those will be recorded. And again, for this visit, like the other ones, there's going to be a kind of a staff form that you fill out that helps you along the way and tells you everything that you need to be collecting during this visit. We have the same blood pressure guidelines at this point. If she has blood pressure issues, you want to refer her to her physician. We collect a second blood sample at that point. It's again a fasting blood sample, and this is you obviously so you'll be collecting the blood sample at this point, like the first time, and then you're going to do a urine pregnancy test just to confirm at the end of the study that she still isn't pregnant. And then there's a study called dosage review, and so for women who have been taking 1 pill a day, you can ask them at that point to stop their medication, maybe not need to taper off. If they've been taking 2 pills a day, however, they need to taper off the medication. So there's going to be instructions that you give to them that they should take 1 pill a day for 3 days, and then 1 pill every other day for the remainder of the week. And you'll need to have a pill counting tray or something. We're not going to dispense a whole extra bottle of pills for just these. So I guess it would be 5 pills or something that she'll need to take. Each bottle of pills that she's going to get has 40 pills in it. So that's enough to cover the 28 days of the 4-week period. And then if there's a couple of days that she doesn't get in there, say until day 30 or whatever, there's a little bit of leeway there. And then there's some extra pills. We calculated 40 would be enough to cover, the intervention time, a little bit of leeway, and then the taper period. So you need to count her pills, but then you need to give that bottle back to her. So I would suggest, again, it's a little tacky to be counted in front of her. You might do that on the side, but then you need to give the bottle back to her with the, and at that point, you should just give her enough pills for the taper. If she didn't, let's say she comes back and of the 40 pills, she still has 20 pills in there. Well, you don't send her back home with 20 pills. You're going to send her with the 5 or whatever it is if she's taking the 2 pills. And then, of course, if she's taking the 1 pill, you don't send her home with anything. So work that into the process. So then at the end of the visit, you're going to give women 3 more weeks worth of hot flash diaries, and you might want to give them 4 just to cover in case you aren't able to get them on the phone when you first call in week 11. And you're also going to give them a postage page envelope because they need to be able to mail the hot flash diaries back because you're not going to see them again at that point. And if you haven't already scheduled the week 11 phone call, you should schedule at that time. And that's supposed to occur about 3 weeks after that last visit.